committee members, citizens, colleagues, thank you for letting me speak. My name is Annette Mercatante. I'm a board-certified family practice physician, in clinical practice for over 20 years, and also a medical health officer in a local public health department in St. Clair County. Much of what I want to enforce has just been said. You know, the risk of chlamydia and gonorrhea is considerable. And I just want to speak on behalf of the local public health departments, which people often think is kind of the boots on the ground for these diseases. And it's true. We are charged by public health law to intervene in these cases and do our best. Needless to say, we don't have the resources to do it. And the reality is these patients get much of their care through the emergency rooms and private practice programs as well. We need more tools, particularly in the case of chlamydia. We are losing the battle with these rising infections. And although EPT is not a perfect treatment standard, it is well studied and supported by a variety of experts, and it will provide us one more tool that will allow us to try and intervene in an appropriate way. I want to speak briefly about the risk, because Representative Ganeski brought up a good point. And that is, the reality is there is always a risk. There is a risk to everything we do. And healthcare professionals evaluate that risk and that benefit from patient to patient to patient. In these situations, there will be situations where patients will not be appropriate to use EPT. And it will be important on the medical community side to properly educate our providers to know when they should use it and when they shouldn't use it. Public health is also charged with following these cases. So surveillance will continue to be done, and we will do due diligence to make sure that there is not unwarranted outcomes. But this is a common sense approach that we all use already, regardless of the protection of the law. Estimates of about 50% of the physicians use EPT for a variety of treatments. In fact, we standardize it for pinworm therapy and scabies therapy. We know that if we don't treat household contacts, the disease transmission gets out of hand. And we would like, as physicians and healthcare providers, to have the protection of the law and to be able to do this with proper guidelines and proper authority. And with that, I guess I'll take any questions or...
Thank you. Members, are there any